Okay, hello everyone. Today we will discuss about the flexor retinaculum. So, retinaculum is basically a modification of deep fascia. Modification of deep fascia. Deep fascia. So, in the region of the carpal bone, you will find the deep fascia get condensed. It is get thickened, and this forms a fibrous sheath-like structure, a band-like structure that is known as flexor retinaculum. So first of all, let's know what are the bones that are included in the carpal. So you can see here, this is image of articulated hand, articulated hand, where you can see the lower end of the radius. This is the lateral side. So you can see this is radius bone and this is the ulna bone. This is the lateral side and this is the medial side, because you can see the two phalanx on the lateral side. So this will be the area of the thumb. You can see the radius bone. So these smaller bones which are organized in two rows, the proximal row, this is the proximal row, and away from it, it is the distal row. So you have in total 8 smaller bone in the area of the wrist, that is known as carpal bone. So from lateral to medial side, you can see in the proximal row, you can see the scaphoid. Then this is the scaphoid. Then next is your lunate. Then medial to the lunate, you have triquetral, and this spherical, small spherical uh, bone on the medial side is your pisiform. In the next row, distal row, you can find this just below the first metacarpal. You can see this bone. It is known as trapezium. Trapezium. Then you have trapezoid. Next, you have capitate and the hamate. So these 8 are the carpal bone. Then you can see the metacarpal, first, second, third, fourth, and the fifth. Then you can see the phalanx. In the first digit, you can only see the proximal phalanx and the distal phalanx, while other digit you can see the proximal phalanx, middle phalanx, and the distal phalanx. Okay, so now coming on to the parts of these four bones. So you have seen the first proximal row and next row of the carpal bone. So from medial, the lateral to medial side, you have scaphoid, lunate, triquetral, and the pisiform. And in the distal row, you have trapezium, trapezoid, then you have capitate and the hamate. So you will find a tubercle in the scaphoid bone, and you can also see the hook of hamate. You will find a hook-like projection into the hamate. Then you have in the trapezium, you have a crest. Okay, so these are the four bony pillars on which the deep fascia is attached, and it gets thickened. So you will find a band-like structure attached on these lateral and the medial bone of the carpal, and that is filling the concavity, anterior concavity of the carpal bones. So here you can see. Okay, so the flexor retinaculum is a strong fibrous band which bridges the anterior concavity of the carpus. So you can see here this white fibrous structure that is attached on lateral side to the scaphoid, tubercle of scaphoid, then onto the crest of the trapezium, and on medial side it is attached on the pisiform bone and the hook of the hamate. So this white fibrous structure, what you are seeing here, is basically it is a flexor retinaculum, because it is situated in the flexor compartment of the wrist region or the forearm region, and because it is a modification, it is a condensation of deep fascia that is known as retinaculum. So it converts the concavity. Suppose the bones are arranged in a concave form. So if you cover this with the flexor retinaculum, this concavity now becomes a through and through tunnel. So now it becomes a tunnel, and that tunnel is known as carpal tunnel. When it is tunnel, that means some structures are passing through the tunnel, and some structure are passing superior to the flexor retinaculum. That means they are not forming the content of the carpal tunnel. So there are certain structures that are passing through this tunnel, that is your carpal tunnel, and there are other structures that are passing just above the flexor retinaculum. As in this diagram, you can see this is the ulnar artery, then you have the ulnar nerve. These structures are lying above the flexor retinaculum, while inside the tunnel you can see there is tendons of long tendons of the flexor tendons of the wrist joint. Then you can see one important nerve, that is your median nerve. These structures are lying below the flexor retinaculum and or through the carpal tunnel. So in your exam it is often asked which of the following structure passes above the flexor retinaculum, which of the following structures, what are the structures that are passing through the carpal tunnel or below the flexor retinaculum, what is carpal tunnel syndrome. All these questions are asked in your viva exam, in your professional exam, in a form of short note. So all these questions are asked in your exam. Now, if you see the shape of the border of the flexor retinaculum, so the lower border, if you see this is the lower border, it is concave downward because we are assuming the person into the normal anatomical position in a standing condition. So this wrist will be, the hand are lying down, so they are basically hanging on the side of the body. So you can find this distal border which is lower border, it is concave downward, and while the upper border which is proximal border, it is concave upward. So this is the shape of the flexor retina. Now you can see this is this spherical bone is, it is the 3D image where you can see the flexor retinacula. This is the pisiform bone, this is the medial side, and this is the lateral side of the articulated hand. So this is the pisiform bone and this is the hook of hamate, and here you can see the scaphoid bone and the trapezium bone, carpal bone. So this fibrous tissue, this fibrous structure, band like structure, that is modification or the condensation of deep fascia at the level of carpal bone. This is known as flexor retina. Now you can see various tendons are passing inside just beneath the flexor retinaculum, and these are the structure which are passing through the carpal tunnel because you can see the bones are lying over here, and this is filled by the ends are filled by this flexor retinaculum. So this gap, this is known as the carpal tunnel. So there are various structures that are passing just below the flexor retinaculum. They are basically lying, they are traversing the carpal tunnel. So this now what you're seeing here, this is the median nerve. This is the median nerve. So median nerve is one of the important structure that are passing through the carpal tunnel or beneath the flexor retinaculum in various pathological conditions, like in case of hypothyroidism, in case of normal pregnancy. There is inflammation of this area, this carpal tunnel, and these there is the and here you will find the median nerve get compressed, and that can lead to tingling sensation in the in this area of the supply of the median nerve. So this is known as the carpal tunnel syndrome. So this is the 3D image of the carpal tunnel. If you cut a cross section at the level of wrist joint, you can see this carpal bone. This is the trapezium. Then you can see the trapezoid, capitate, and the hamate. This is the cut section. Okay, this is trapezium. This is the lateral side, and this is the medial side. So you can see here this green color structure is the flexor retinaculum. On the lateral side, it is giving a deep slip, and that is going to attach. This is a groove in the trapezium, which is bounded by the lateral and the medial crest. So you can see here this deep slip is going to attach on the medial lip of the crest of the trapezium, and this is how the flexor retinaculum is giving the deep slip. So in between the deep slip and the flexor retinaculum, you will find there is passage of one tendon, the tendon of flexor carpi radialis muscle. So flexor carpi radialis muscle is passing through this gap between the flexor retinaculum and the lateral deep slip of the flexor retinaculum. On the medial side, you can see here this flexor retinaculum is giving a superficial slip, and this is known as volar carpal ligament. This is known as volar carpal ligament, and in between the flexor retinaculum and the volar carpal ligament, you can see there is passage of the ulnar artery and the ulnar nerve. So ulnar nerve and ulnar artery, they are passing through the underneath the volar carpal ligament, while the flexor carpi radialis, the tendon of flexor carpi radialis muscle, it is passing on the lateral side between the lateral deep slip and the flexor retinaculum. So now you can see there are various structures that are lying superficial to this flexor retinaculum. So you can see here, this is the palmar cutaneous branch of the median nerve, then the tendon, that is palmaris longus tendon. Then you can see the palmar cutaneous branch of the ulnar nerve. Then you can see the volar carpal ligament over here, and the ulnar artery and ulnar nerve. U for ulnar and U for your upper. So the ulnar artery and ulnar nerve, they are lying on the superior or the upper side of the flexor retinaculum. While other structure like median nerve, the tendon of the flexor digitorum superficialis, tendons of flexor digitorum profundus, tendon of flexor pollicis longus, these structures are lying inside the carpal tunnel or below the flexor retinaculum. So you can see here the structure lying above flexor retinaculum and a structure lying below flexor retinaculum. So structure lying above flexor retinaculum, ulnar artery, ulnar nerve. Then you have the palmaris longus tendon, and also the palmar cutaneous branch of ulnar nerve, palmar cutaneous branch of ulnar nerve, and also the palmar cutaneous branch of median nerve. Palmar cutaneous branch of median nerve. These structures are lying above, while the median nerve, the tendons of FDS, FTP, flexor pollicis longus, flexor carpi radialis, all these structures, they are lying below the flexor retinaculum and they are passing through the carpal tunnel. So